Did you know that some common plants you might have in your backyard can be true allies in controlling diabetes? Today, we're going to discover 5 scientifically proven medicinal plants that can help regulate blood sugar levels naturally and safely. If you or someone in your family lives with diabetes, be sure to watch until the end of this video, because this information could make a real difference in your quality of life and even reduce your dependence on synthetic medications. Diabetes is a condition that affects over 400 million people around the world, making it one of the leading causes of death and disability globally. While conventional medical treatment is essential and should never be abandoned, nature offers us valuable complements that can significantly enhance our health care. For thousands of years, different cultures have used medicinal plants to treat blood sugar-related disorders, and today, modern science confirms much of this ancestral knowledge through rigorous and controlled studies. Before we dive deep into these 5 extraordinary plants, it is crucial to emphasize that these plants do not replace medications prescribed by your doctor, but they can be excellent allies when used consciously, consistently, and always with proper professional guidance. Our first plant is cinnamon, an aromatic spice that you probably already have in your kitchen, and that could become one of your best friends in glycemic control. Cinnamon, scientifically known as Cinnamomum verum or Cinnamomum cassia, contains extraordinary bioactive compounds called polyphenol, especially type A procyanidin, which has shown a remarkable ability to improve insulin sensitivity in the human body cells. Scientific studies published in prestigious medical journals show that regular consumption of cinnamon can reduce fasting glucose levels by up to 24%, lower glycated hemoglobin by up to 18%, and improve the lipid profile of people with diabetes. The mechanism of action of cinnamon is absolutely fascinating from a biochemical standpoint. It mimics the action of insulin in muscle and fat cells, facilitating the entry of glucose through the cell membrane and consequently reducing circulating sugar levels in the blood. Additionally, cinnamon inhibits digestive enzymes like alpha-glucosidase, slowing the absorption of carbohydrates in the small intestine and preventing glycemic spikes after meals. To get these therapeutic benefits, you can consume between half a teaspoon and 1 full teaspoon of cinnamon powder daily, strategically sprinkled over fruit, natural yogurt, oatmeal, or incorporated into aromatic teas. Ceylon cinnamon is considered the most effective for specific medicinal purposes, as it contains lower amounts of coumarin, a substance that in excess can be potentially harmful to the liver when consumed in large quantities for prolonged periods. The second plant that deserves special attention on our list is green tea, an ancient beverage originating from Asia, rich in powerful catechins, especially epigallocatechin gallate, also known by the acronym EGCG. These extraordinary antioxidant substances act in multiple synergistic ways for glycemic control. They significantly increase glucose uptake by skeletal muscles, reduce excessive glucose production by the liver by inhibiting gluconeogenesis, improve the function and survival of the pancreas's beta cells responsible for insulin production, and also combat the oxidative stress that contributes to diabetic complications. Extensive epidemiological research conducted in Japan and China indicates that regular consumption of green tea can reduce the risk of developing type 2 diabetes by up to 42%. While controlled clinical trials show that for already diagnosed diabetics, green tea can help maintain more stable glycated hemoglobin levels and reduce insulin resistance. The ideal is to consume 3 to 4 cups of green tea per day, preferably between main meals to maximize the absorption of active compounds and minimize potential interference with iron absorption from food. It is extremely important to prepare the tea with the proper technique. Use water heated to approximately 80 degrees Celsius, 175 degrees Fahrenheit, never boiling, and let the leaves steep for only 3 to 5 minutes to extract the maximum beneficial compounds without releasing excessive tannins that can cause an unpleasant bitterness and gastric irritation. Our third plant ally is Bauhinia forficata, a plant traditionally used in Brazilian folk medicine whose anti-diabetic benefits are now rigorously confirmed by contemporary scientific research. The characteristic bovine hoof-shaped leaves of the Bauhinia forficata contain a synergistic combination of flavonoids, glycosides, saponins, and other bioactive compounds that have demonstrated significant and sustained hypoglycemic action. This extraordinary plant acts mainly through multiple complementary mechanisms. It increases the sensitivity of peripheral tissues to endogenous insulin, stimulates glucose uptake by muscle and fat cells, inhibits enzymes that break down starch into simple sugars, and also has antioxidant properties that protect pancreatic cells from damage caused by free radicals. Double-blind, controlled clinical trials show that standardized extract of Bauhinia forficata can reduce post-meal blood sugar by up to 30%, meaning it significantly lessens the dangerous sugar spikes that commonly occur after meals and are particularly harmful for diabetics. The therapeutic tea prepared with the plant's dried leaves should be consumed 2 to 3 times a day, preferably 30 to 40 minutes before main meals to maximize its regulatory effect on carbohydrate absorption. To prepare it properly, use 1 generous tablespoon of the dried and previously fragmented leaves for each cup of boiling water. Let it steep for 10 to 15 minutes in a covered container to preserve the volatile oils, and strain carefully before drinking, preferably while still warm. The fourth plant in our special selection is bitter melon, also known scientifically as Mamortica carrantia. This fascinating climbing plant, common in tropical and subtropical regions around the world, contains at least 3 distinct substances with proven anti-diabetic properties: charantin, vicin, and polypeptide P, the latter being structurally similar to human insulin. These extraordinary bioactive compounds act in a remarkably similar way to endogenous insulin, efficiently facilitating the transport of glucose across cell membranes and into the cells where it can be properly metabolized for energy production. Even more impressively, bitter melon has shown in experimental studies the ability to stimulate the regeneration and proliferation of the pancreas's beta cells, potentially improving natural insulin production in individuals with compromised pancreatic function. Controlled clinical research shows that regular and properly dosed consumption of this plant can significantly reduce blood glucose levels both fasting and after meals, improve glucose tolerance as measured by standardized tests, and even reduce the need for anti-diabetic drugs in selected cases, always under strict medical supervision. The medicinal tea can be prepared using either the dried leaves or the immature fruits, using 1 teaspoon of the plant material for each cup of boiling water. Due to its characteristic intensely bitter taste, which can be unpleasant for many people, a practical alternative is consumption via capsules containing standardized dry extract or concentrated tinctures, always strictly adhering to the dosages recommended by qualified health professionals experienced in the use of medicinal plants. Our fifth and final plant in this special selection is Gymnema sylvestra, traditionally known as the destroyer of sugar in India's ancient Ayurvedic medicine. This extraordinary plant has truly unique properties in the plant kingdom. Its specific active compounds, especially gymnemic acids, have the surprising ability to temporarily block the sweet taste receptors on the tongue's taste buds, dramatically reducing the craving and compulsion for sugary foods and sweets in general. This psychological and physiological effect can be extremely valuable for diabetics who struggle with sugar addiction and have difficulty maintaining a proper diet. More importantly, from a therapeutic standpoint, Gymnema sylvestra has demonstrated in rigorous scientific studies the extraordinary ability to regenerate and stimulate the proliferation of insulin-producing beta cells in the pancreas, an effect that could be revolutionary for type 2 diabetics with diminished pancreatic function. Furthermore, this plant significantly improves glucose utilization by peripheral tissues, especially muscles and the liver, increases insulin sensitivity, and reduces glucose absorption in the small intestine. Double-blind clinical studies published in prestigious scientific journals show that the regular and properly supervised use of this plant can reduce the need for anti-diabetic drugs by up to 50% in some selected patients, always under strict, specialized medical supervision. Gymnema sylvestra can be consumed as a tea prepared with the dried leaves, using 1 teaspoon of the plant material for each cup of boiling water and letting it steep for 15 to 20 minutes, or through standardized extracts that guarantee specific concentrations of active ingredients. It is absolutely fundamental to understand that these 5 extraordinary medicinal plants work most effectively and safely when incorporated into an overall healthy lifestyle that necessarily includes a balanced and consciously planned diet, regular and appropriate physical exercise for each individual condition, proper stress management through proven techniques, quality restorative sleep, and constant, specialized medical follow-up. Never stop or replace prescribed medications without the express guidance of your endocrinologist, as this can result in serious and potentially fatal complications. Some people may experience individual allergic reactions or dangerous drug interactions with these plants, especially when combined with anticoagulant, antihypertensive, or other hypoglycemic medications. So it is absolutely essential to consult a qualified healthcare professional before starting any complementary treatment protocol with medicinal plants. To maximize the therapeutic benefits of these extraordinary plants and ensure their safe use, some important practical guidelines should be strictly followed. First, consume the plants regularly and consistently, as their beneficial effects are cumulative and depend on stable blood concentrations of the active ingredients. Second, maintain a diet rich in soluble and insoluble fibers, non-starchy vegetables, and lean proteins, and drastically reduced in refined sugars, white flours, and ultra-processed foods. Third, engage in regular and progressive physical activity, as exercise synergistically enhances the action of these plants on glucose uptake by the muscles. Fourth, monitor your glucose levels regularly with a home glucometer and periodic lab tests to objectively track results and adjust dosages when necessary. Fifth, maintain constant and transparent communication with your medical team about the use of these plants, including dosages, schedules, and any perceived effects. And sixth, be patient and persistent, as the benefits of medicinal plants generally manifest gradually over weeks or months of consistent use. Always remember that the effective control of diabetes is a long-term journey that requires constant dedication, discipline, knowledge, and patience. These 5 extraordinary medicinal plants are extremely valuable tools that nature generously offers us, but they work optimally only when they are part of an integrated, holistic, and scientifically based approach to healthcare. If this detailed content was genuinely useful and enlightening for you, don't forget to leave a like on this video, subscribe to our channel, and hit the notification bell so you don't miss any content on natural health that could transform your life. Also, share it with family, friends, and acquaintances who could significantly benefit from this precious information. Your health is unquestionably your most precious and irreplaceable asset, and every small, conscious step towards healthier and more natural habits makes an extraordinary difference in your present and future quality of life.